All right, in our first half hour, we spoke with Muscatine Police Department's Deputy Chief, Steve Snyder. He was the recipient of the Muscatine Police Department Medal of Merit earlier this month for his work establishing the department's co-responder program. This program pairs a licensed mental health professional with law enforcement to go out on calls with police. But he wasn't the only one who was honored. For the first time ever, the Medal of Merit was also given to a civilian. Amy Gold is the mental health professional in the Muscatine Co-Responder Program, and she joins us now. Amy, thank you so much for being here with us. For those who are just joining us at home, what is the Co-Responder Program? How does it work?
The co-responder partners a mental health professional and a law enforcement officer together, and we go out and assist on any calls that maybe is needed.
I know every day is probably different for you, but in general, what does a typical day look like for you?
First thing in the morning, I'm paired with a police officer for their shift, and I ride along with them to all the different calls. Behavioral health support is provided then as needed. I help de-escalate situations, figure out what's going on right away, and connect to different support services. The Robert Young Center provides care coordination services, psychiatry, therapy, and substance use treatment.
Okay, so give me an idea here of what this might look like. You're out on a call with an officer, and maybe a call comes in, someone is at a grocery store and they're screaming and carrying on. In the past, what would have happened and what happens now that's different?
In the past, law enforcement would go themselves and tip to de-escalate. Now I'm called to the location, and I go in, talk to them, kind of see what's going on. What can I do to assist them? How can I help? And at that very moment, then I determine whether or not, do they need to go to the hospital for a further evaluation? Can we support them in the community and keep them safe there? And then how we move forward. Typically, a referral for care coordination would then be submitted, so they continue to have the support.
We're seeing a lot of these programs become more popular all across the country, in our area as well. And it seems fair, you were asking police officers to do the jobs of mental health professionals. I mean, not only are you helping the people that you're de-escalating with, what does this do for the officers that you work with?
I think it's been great. I think they enjoy it. I know in the beginning that nobody likes a writer, but in the beginning they were really welcoming. They're even more welcoming now. We really do have fun, like Steve said. We laugh and have a good time, but we're serious when need be. We've gotten really close. We work well together. We are partnering up and supporting the community like we need.
Mm-hmm. Well, you go out on all sorts of calls, domestic violence calls, suicide calls, substance abuse, homicides. But one call in particular, what happened this past summer, it was the deadly shooting at the Muscatine Hy-Vee. What was your role in those moments?
Following the moments they called me, I was actually off scene, but they called me in, and I spoke with Hy-Vee management essentially, and they provided myself and a coworker with every employee's phone number, and we contacted every single employee that day, as well as 2 days later and then 4 days after as well, to see how we could assist them. Some were connected to resources right away, others took a few days, but it was just a matter of supporting the community when it really needed.
Yeah, because that's something that's important to point out, right, is you're not just there for victims, you're also there for family members or anybody else who might have been impacted. But Amy, I just wanted to get your sense of this because you're the one living this every single day. What is the benefit of this program? How successful has it been, and what's the impact to Muscatine?
I live and work in Muscatine, and so I really care about the community. I wanted to give back and help create a healthier and safer place for everyone. So that's really why I wanted to get involved with the co-responder program. But really, we are meeting people in crisis, supporting them, and linking them to the critical resources and services that we have available.
And your position, this program is funded through a grant that does run 1 year at a time. It's coming up again for renewal in June of 2026. How hopeful are you that it will get renewed?
I'm very hopeful. As Steve said, our numbers are fabulous, and I truly believe that we are benefiting from the support and providing good services to the community. So I'm very hopeful that we can continue on.
And then, Amy, my last question for you is, I mean, it seems like I know the answer to this, but is this a program that you think should be implemented all across our region, all across our viewing area?
Absolutely. I would love to see it everywhere.
Well, Amy, thank you for your time today, and congratulations on your Medal of Merit. We really appreciate you being here with us.
Thank you.
You guys at home, if you want to share this story, you can find our online version up at WQAD.com. Just click on the As Seen on TV tab.